Hello, everyone. Thank you so much for joining us today. If you are live with us, thank you for making the time, and we'll be able to answer your questions here live. And if you are watching at a better time for you, like maybe you got your training in during that 12 o'clock window and now you're going to be watching at a different point, totally awesome. And a reminder that we will get you expert advice. Our expert will be able to answer your questions as well. Just go ahead and put those in the question box. And if you're joining us live, tell us where you're joining us from, and also if you have any questions. I will start off with, I am Ashley Koff. I'm a registered dietitian. I am post a HIIT workout today, so I'm very, very interested to learn about this topic that we have. And just a reminder, as CEO of the Better Nutrition Program, first of all, our company is a tool that provides practitioner-developed assessment tools so that practitioners and patients can have the information that everybody needs in order to create that better nutrition plan. Surprise, surprise, us practitioners are not mind readers, and we actually need to know from you what's going in and on your body most often. So we want to have those assessment tools. And through that, I identify what I call better nutrition experts. And that's why this is called the Better Nutrition Expert Interview Series. So I always like to start off with, and throughout the interview, we'll be defining terms because we want to make sure that we're all understanding what the intention is of words that we're using, right? Like I might say vegetarian and it could have 7 different definitions. So a better nutrition expert is somebody who understands the science, has reviewed the science, and has learned how to review science. And then, so they're what we call science-based, but also is somebody who puts this into practice. Both may practice it in their own life and hopefully is practicing it with or is choosing to practice it with others. And that makes them practice-based. So our experts are evidence-based and practice-based because science often leaves out the H factor, the U factor, the human factor. And we want to make sure that the information that we're getting is doable and relevant and, sort of helps you navigate, what we might not hear from the science. So that's all of my introductions for today. And we're going to go right into this because I have a lot of questions. I'm really excited about this information from Becca. So by way of saying welcome, Becca, I would love to understand. So we are going to be talking about REDS. We're going to actually have to define that. But we want to even just back up. And I would love to understand for you how you got interested in working with women, female athletes, women that train like athletes, and their nutrition. So let's start there and welcome.
Well, thank you for having me on. I'm really excited. So I love how you said that, like evidence and practice. You got to have the blend of both. So, well, first, having been a collegiate athlete, I got to witness firsthand kind of that drive and probably pushing a little too far and understanding that for many it's unintentional. They just think they're doing what they're supposed to be doing, but they miss the mark. And so as I navigated my dietetics career, I always had an interest in sports nutrition and was just kind of waiting for that opportunity to start that. And then kept finding these athletes that were coming in that were, a lot of them were seeing me for, I want to lose weight or I need to perform better. And then you would find like, wow, you are vastly underfueled. And so from there, just continuing to dive into the information, continuing to build up a lot of case studies that then I just found myself kind of specializing in. And I think it helped because I understood the mentality that went around that. I understood a lot of the pressures that can be within that culture of sport and training programs that may be specific to that sport, and then diving in, especially now with being an eating disorder dietitian too, you start to see the psychological component and also understand what happens to the metabolism when they are underfueled.
Yeah.
So that's kind of a long-winded answer.
No, it's great. And I think it's such an important piece. And what we're going to dive into today is also, is having that conversation about how you assess someone, how you go through that part. What are some of the things you should be thinking about if somebody that's watching actually wants this information for themselves or for their client. But before we dive into that, the word female athlete, thankfully, like it's just this like awesome era, right? And I think one of the things that I've encountered working with practitioners and actually with some of my clients is they're not sure if they fall into that category, right? So, I know 40-year-olds who are training like athletes at that life stage, and also at people who were athletes when they were 20 that still consider themselves athletes, and nothing about their current training and that piece is that part. So when we talk about today, like who the audience is that we're going to have a conversation about, how do you sort of put in perspective who is a female athlete, what distinguishes them for how we want to, be focusing on the assessment and the advice that we're going to give today?
Oh, great question. I think so many times we get kind of caught in the label, but I simplify it by any person that is going out and wants to achieve a specific performance goal. It doesn't even have to be in a competition. It may be that I want to be strong enough to lift X pounds in my deadlift, or I want to be able to hike the Grand Canyon and, not end up not being able to walk for the next 5 days. I consider all of those athletic goals and endeavors. So my job is to help them be the best fueled, conditioned person that they can be so that they can perform those outcomes.
Awesome. So if that is you or that is your client, then this information is for you. So done on that part. Okay. So the world of nutrition, super crazy these days. I got a couple of different questions that came in. Is it okay to do intermittent fasting if you're training? Is it better, to do intermittent fasting if you're training? Got a lot of the rounds of questions about keto, vegetarian, paleo, everything I'm sure you encounter on a regular basis. So before we go into the diet or the answers on some of these key pieces, I want to take a step back to what does the female body need to do to be functioning, to be in a place where it can be achieving these goals. So let's talk a little bit about the systems and the needs of those systems. Maybe we can start off with even just functionally from a mental health standpoint, and like that gut-brain connection and digestive health, and then we'll move on from there.
So I think for that female athlete to perform at their best, they have to have the bases covered. So in the start of my book, I talk about we have to have our energy bills paid first. Before then we can start to build upon performance goals, because if not, it's going to start pulling from those. And that may be digestion starts to slow, food intolerance is developed, amenorrhea, which is the loss of menses for 3 months or more, or even irregular periods, because that and thus turns to poor bone health. So they really have to make sure that all systems are going consistently normal for them. And that's another thing, is define what is normal for them. And then we go from there and we build upon that foundation for their athletic goals.
Great. And so why don't we start with, at this point, I think it's a great time to define what REDS is, RED-S, and then we'll get into how we find our sweet spot, which, oh, by the way, is the name of her book. And as I told you in the top, just get the book. It's available at Amazon, get the book. And I think we even said, I forgot to even mention this, we're going to pick one person over the next, let's say, what day are we today? It's Friday. We'll give you until Monday. We'll pick one person on Monday who's going to be the winner of this book. So go ahead and comment and ask questions and all that good stuff, because we're going to pick somebody who's engaged in this discussion. Yeah.
Great. Thank you. So what Redis is basically how much energy is left after you've taken all those basic physiological needs, which I think people forget. This means brain needs 30% of your total daily calories, your heart, your lung, digestion, even just having a mood. So it's how much energy is left. So that's usually based on your muscle mass, because if not, then it will start to compromise and use muscle for energy. So if somebody has body composition, they usually look at 35 calories per kilogram of fat-free mass that's left. If you go below that, you probably have low energy availability. And that just means that the body can't easily access that energy to be able to do what it needs to do. So it starts breaking down into the savings account and using other energy reserves, formerly known as the female athlete triad. which looked at weight loss, loss of menses, and stress fracture. But we understand it's a whole lot bigger picture, and we forgot males.
Yes.
To what's known as Redis now.
Got it. And, I get a lot of parents of young adult athletes, so high schooler, women in high school, and then also into college, who will ask me questions just about what are the signs? Like, how can I know? So before I'm getting into the clinical measurement, so what are some of the signs to look for either in someone that you're working with or that you're observing, i.e. a family member or a friend or somebody that, what are those signs? Sorry. Yeah.
So it's tough because for a lot of them, they haven't necessarily started to perform worse. So if they're coming on their own or a parent, they luckily at that point probably don't have an injury. If they're coming from sports medicine, they're probably being seen for an injury. So I start trying to match up the timeline. When did they start to make changes to either their training routine, like maybe they've had an increase in training? Did they change their diet? Did they have a growth spurt? Things like that. And then what changes specifically? Did they decide to, quote unquote, start eating healthier? So they cut out particular foods, really boosted up their fruits and vegetables. And then was there any other physical symptoms that started at that time? Like maybe what I get all the time is, well, they were eating all the time and they were full, so we just didn't think anything of it, but they started to lose weight. Well, they're eating very high fiber, high satiating foods, and they weren't getting their energy needs. Or all of a sudden they're being worked up for GI issues when it's really just at that GI tract, or stress, like you talked about, that brain gut axis. Sophomore, junior in high school, that's when they have the heaviest school load. And so they don't realize that also translates into their health. So there's not any good questionnaires or assessments yet because athletes are very smart and they usually find their way around it. But when I go through and I kind of write out energy balance, like intake versus output, and what all needs their energy, they can start to say, or I'll see the parents' eyes light up like, oh yeah, remember you started wearing sweatshirts in the summer and you were complaining about being cold, or, you used to get just occasional cold, but you were sick during the end of season. And then you can see them put the puzzle pieces together.
And do you find that as you're putting that together, do you find that somebody's sweet spot then for nutrition will be static in terms of what they need for the period of that training, or do you need to sort of monitor it because it may shift depending? Okay, yeah, take me through that.
Yeah, thank you. So I tell them there's some certain things that you can look for. So as they have a training log, they also need to kind of put in there, like, how hard are you having to work to do the workload that your coach is asking or you're asking? Is sleep changing? Are you getting enough good sleep? That's some of the positives with our watches, is that we can look at how much deep REM they're getting. I love for them to collect morning heart rate data. So in the UK, they're much better at being proactive with injury risk. So they actually look for if there's trends that the heart rate's going up, because that means that body is not able to recover. So they get those overtraining syndromes faster before it develops into Redis or an eating disorder. And then we start to take a look at, I see a high risk between like cross country, then they start conditioning for track, then they go into track so they don't have their down period. And those bodies just get really run down and they downplay the intensity. So also teaching them that you have to look at how much time, but also the type, kind of using that fit principles, and then intensity.
I want to go back for 1 second to something that I think threw in there. I think it's what I heard, but you were saying about measuring their sleep. You use their watches. Is there a watch that are you just saying in general today because we can track that part, or yeah, okay. Is there just, and without, we're not promoting any brands here, but is there something that you feel like is a better tool or one that you like using with your clients in terms of measuring that?
The only one I like for simplicity is that Garmin Connect, because it will track their sleep and then it goes automatically to their database. And I always like that bird's eye view. So for example, I have an athlete that's getting ready for Kona, and every time he starts building up in his training, he ends up sick or injured. And like, he's one of the top of the pack. So when we started looking, I noticed that as he started to get sinus infections, upper respiratory his REM was down an hour in deep sleep. He actually was starting to get about 1,000 calories less, which, that sounds like a lot, but when you're having to take in 5,000 to 6,000 calories, that's a lot of work.
Yeah.
And I noticed his heart rate was just slowly trickling up. So we set kind of a rule, like, okay, 2 to 3 days of noticing those trends, you need to back off your training and you need to bump up your nutrition. And so you're able to stay within your sweet spot a little bit more proactively rather than having to backtrack.
I love that. One of the things that comes to mind as you're talking is, a lot of times I'll talk to women post for when they have their first child, or if it's a conversation about having their first child, about how, you've got all your stores like for your first child, but once you've had a child, given birth, and then your second child, and as the middle child, always feel like I didn't get as much, that kind of thing. No, that's never happens. The kid always gets it, but mom is depleted. And so this whole idea of, post each pregnancy, making sure that you're replenishing the nutrients, and certainly post any pregnancy, getting somebody back. And so that came to mind for me because when you were talking about the cyclic athlete, where you've got, these either different sports or different training times. Hey, I'm training for this Ironman, and then I'm doing this other. A lot of times there are events, maybe even smaller training events, that are preparation for larger training events, but they're still events. And so what I want to talk about here is that how do you shift into what you do for what's your recovery sweet spot in terms of replenishing the nutrients, digestion and those things. Yeah.
Oh, I love that. That is one of the biggest things that's so hard to get people to buy in. Is I say rest is active rest. We don't heal, we don't repair, we don't replenish unless we make sure that we still are getting adequate nutrition, even if you're not training. So like I keep going back to running, but they'll usually take 2 weeks off. Well, a lot of runners are like, oh, I can't do that. I'm in a decondition. And then when I explain, like, that's trying to fill back up that gas tank. That's trying to let those muscle fibers heal, which thus in turn is going to increase your mitochondria, be able to do better endurance. So the same thing goes for even those moms, is like in between there, what are you going to compete for? Because if you're not able to rest and replenish like you're supposed to, it's going to come at the expense of something. So whether that's your gut health, your mental health, your energy level, got to have the downtime.
Yeah, I love that. So of course, protein is the only nutrient that you need, right? Ever. That's like the sports. Just protein. Like that's all that needs to happen. So in light of the emphasis on protein, I actually was sharing an article, a really good review paper, that's not something that often flows out of my mouth, actually. A really good review paper that was looking at protein and protein intake and the benefits of getting whole food sources of protein because of the additional nutrients that come in, as opposed to just hitting a protein powder. And I understand how that can be confusing, because a lot of us like the usefulness of a protein powder, and not all protein powders are the same, right? Some could be an isolate versus a concentrate. So I'd love to just have a protein conversation for a moment, because I think in the name of protein, I'm seeing a lot of people who are making their liver, their kidneys have to work a lot harder, and they're also maybe not getting some of those support nutrients that optimize how the system uses, the protein. So talk to me a little bit about just specifically the protein conversation as it relates to your sweet spot.
So as you can tell, I love a lot of analogies. Yeah. And so I wrote this blog one time about like the CEO of you, and it's talking about how within an organization, we have certain roles and responsibilities, and the goal is to let them do their thing and not overlap. So when I work with a client, I always say like, okay, what is protein supposed to do for your body? What's carbohydrate supposed to do, and what's fat? Okay, if you're not going to eat enough carbs and you're going to bump up your protein, that means now it's got to do more jobs. And that may mean at the expense of being able to build more muscle, boost your immune system, because now it's going to have to be doing something else that it's not meant to do or it doesn't like to do. And so it helps them start to understand like, oh yeah, I need carbs for this function. And it's not always energy. People always think of carbs as only being our energy. That's also melatonin. That's helping serotonin get up in the brain. That helps lower cortisol afterwards. So we see less injury risk in those that do a more moderate carbohydrate. And then that leaves protein to do what it's supposed to do. And you're right. I'm big on food first, as most dietitians are, because it comes, one, it's the way our body likes to digest and use it. Two, it usually comes as a whole amino acid or close to it, and then we usually eat it in with foods that help enhance absorption. Where if we have just isolated out nutrients, we have to continue to add more and more. And we also now are understanding that many of these synthetic forms, our gut bacteria doesn't like it, so it starts to alter, and that in turn affects our health.
Yeah. So the answer is not just protein, which I love. Thank you on that part. So we've got a few minutes left, and I got a barrage of questions. Ashley, so another Ashley jumped in and said, loved reading Finding Your Sweet Spot, good information and a great resource on how to properly fuel the body. So thank you, Ashley. And also, by the way, great name. So very good on that piece. So maybe we can tackle it this way. Fad dieting and performance. So, I think that the ones that really have gotten confusing are, I'll kind of lump, and maybe they're not meant to be, but I'm going to do it. So it's whatever. This is my interview. So keto, paleo, and intermittent fasting have kind of, because I think of the popularity of CrossFit Games, some of these like really like high performance athletes that are out there talking about, these shifts. And, you just talked about the CEO of You, that your body needs these different nutrients. So is there a place for those? And also, how do you, like, within finding your sweet spot, like maybe there's a time in your training that something like that could be more favorable, or are they bunk and we just shouldn't go that path? Give me your thoughts on that.
We could have a whole nother interview.
Yeah, I know, right? Yeah.
So one of my favorite things to do right off the bat when I work with a client, and we talked about like what changes are they making, is for them to then say, okay, what performance outcome were you wanting to change, and did it actually even match up? About 99% of the time, they find that the two of them didn't even match up. So example would be something like keto. So keto has been used for all sorts of different disorders, diabetes, seizure disorder, and now it's made its way into athletics. Now, does it have some merit maybe for ultra endurance runners, because it allows them to be able to tap into their body fat stores, which are, an infinite supply of energy? Yes. So that gives us about 2 to 5% of our athletic population that could be a benefit for. What they did find was that then, sorry, I'm not used to these updates that come on my computer. What they did find was then anybody that's doing something that requires a kick at the end, like a marathon, a half, even shorter distances, they don't have it, because now they don't have their carbohydrate stores. And the other part too is, remember, we talked about carbs help with inflammation. They start to see some longer season injury risks go up in those that have done that. So just being able to point out, sure, there's some positives, but can we compromise in the middle of that and then maybe do a more higher fat, not necessarily keto, go with more moderate carb, and then let's see how that works for you. Same thing with paleo. Okay, well, if you're going to be cutting out dairy, where are we going to get our calcium to help with your bone health? And if they can come up with what I call a good lateral change that's going to meet their nutrition, I'm fine with that. We don't need to get caught in the semantics of what it's labeled, but a lot of times they don't. So that's where I sort out the science, providing facts back to them, and being able to say, like, actually, that doesn't support performance outcomes as well.
Great.
I hope I answered that all right.
Yeah, no, 100%. And I, of course, will plug our calcium evaluation and menu, because I think if you are going to transition away from some of the stated or known like sources of calcium, it's actually delicious and easy, but you do have to add the numbers up, like in the same way you're adding numbers up for how many miles you're going to get to or that kind of thing. So, go ahead and check that one out if you're looking to figure out how to meet your calcium needs. Okay, so I had one other area that I wanted to explore is there's for a lot of athletes, they focus, especially if it is your job. But as we talked about this, there are a lot of people who have these goals, and that's how we're defining them here. And they have to perform in the rest of their life. And that performance may mean a job that they're going to, maybe that they travel for, or their home, or, whatever. They have to show up as family members. They may have to show up and be choosing to want to have a family. So I'm thinking about getting pregnant. I'm thinking about, what that piece is going to be. And then also they may be choosing to say, hey, I want to achieve this goal. And now that I've achieved this goal, I'm going to take some time off from that. So I'm going to be in like a non-athlete phase. So what I'm interested in is, how do you navigate the dance between being an athlete, as we described at the start of this, as somebody who has that goal and we're working towards it, so our nutrition, and we're dialed in for our sweet spot on that part, and we're trying to avoid, and follow everything to avoid REDS, and then flipping over to I'm the non or the athlete on time off, or I have a different objective at that part. Yeah. Because I think that's an area that a lot of people really struggle with, where they try to maintain their nutrition that they were doing as an athlete, or they really fumble from moving out of season or out of athlete performance time.
So it almost sounds like you're talking about kind of that transition period.
Exactly. Thank you. Much more succinct.
Yes. Okay. And that's too, like when I develop a nutrition plan for them, I always say, like, here's our foundation nutrition. Here's our pre and our post and what you need for recovery. So it makes it a little bit more simple than when they're in a rest period. We pull those out and we don't change a lot with that. And meanwhile, trying to build in some intuitive eating skills, or if they've, had a whole lot of food dictated to them, meaning that they didn't have a lot of selection, we work on eating competence first. Mm-hmm. Then we go to intuitive eating, so they can match where their hunger's at and their fullness, and let that adjust what they need to do with their meals. But yeah, that's really important. Is performance also means as a parent, mm-hmm. as a spouse, at your job. I joke, like, not joke, but in my eating disorder work, I have to stay on top of eating, because if I start going cross-eyed and yawning and they're telling me something that's really vulnerable, that's going to hurt them and be upset. So I stay on top of my nutrition so I can be alert and be present in their discussion. So that's a performance goal that means a lot to me. Mm-hmm.
So I like that. Actually, the way that you're describing that is setting performance goals for those areas and really looking at your nutrition and how your nutrition can help you meet those performance goals, like those non-athlete. Yeah, that's a great way of thinking about it. So you threw in the phrase, very popular right now, getting very confusing. Somebody said to me, is intuitive eating mean that I can have a cupcake whenever I want it? So define intuitive eating and what you're speaking about, how it applies to this conversation. Yeah.
Well, I'll put it in my terms.
Yes.
And again, analogy. So we all love a massage, right?
Yes.
But if we had a massage every single day, would we still get the same out of it that we did day one? Probably not.
So, no, I'm just kidding. Yeah. I want to do that test. That's what I'm saying. Yeah.
Okay. That'll be for the next one.
Exactly.
So when we look at when you start to incorporate these foods, I think there is a honeymoon phase where people get excited that, I can now eat this with permission. My key when I ask them is, what specifically are you wanting out of that cupcake or that food? And if they can say, I really want the chocolatey buttercream with this, then they probably want that food to savor and enjoy. If it's doing it just because they can, that's not intuitive eating. Mm-hmm. You're using your intuition to connect what you need to have to nourish you, but also what's going to provide pleasure and satisfaction.
I love that.
I hope I define that well.
Yeah, absolutely. And I think a final piece, I got asked a number of questions. I actually just sent them over to your website and to the book, but parents who are raising young athletes, and they have a concern that there were a lot of questions, like, how do I, the school isn't feeding the kids right, that what they're not eating, they're eating, it's the typical, right? They're eating lunch at 10 a.m. and then they're going to after school sports on that part. So so I guess I will ask this question publicly in case anyone is battling or seeking the same thing. Do you work with kids, or is there or is that a space that there's a program for? Take me through that part.
Yeah, absolutely. So one is to advocate to the school. Hopefully they allow them to have snacks. It's so tough because, they may have a 10 a.m. and then the very next day they turn around, they have a 1 p.m. lunch. So it's kind of hard to get the school to change. So telling them, like, okay, can you eat this bar from class to class so you get your snacks in? Mm-hmm. Then we have to maximize what we're doing with breakfast and dinner, because that's a little bit more on your terms. But I think, especially with that age group, having them plan it out, have quick, convenient nutrition that's there in their locker room, their backpack, their car, so they don't have that excuse like, oops, I didn't bring it. And then as a parent, or if you can be on the school board, try to advocate for patterns that are more conducive for normal eating.
Yeah. And if somebody is concerned, and this is very serious, it also came up, if somebody is concerned about a female athlete having an eating disorder or disordered eating, the woman that wrote me was concerned about how to actually ask the question or address it, because everything is justified around, like, as you said, I'm meeting my performance goals and this is what I need to be doing. And there was a concern about how do you help someone who may not even be aware that what they're doing is, is this disordered eating, or may have an eating disorder in that part.
I'm glad that she asked that question. So what I usually do is gently start out. And if an athlete is just having some disordered behaviors because of lack of knowledge or not putting the puzzle pieces together, they're going to do whatever they can to get back to their sport or overcome whatever is ailing them. If it's a disorder, their anxiety is going to go through the roof. So you'll see them come back and I'll be like, how come you weren't able to increase your snack or do this at lunch? Oh, I was just fearful I was going to gain weight. Well, did you notice your times are getting slower, or did you notice you're not playing as well? And then kind of gently pushing them. And that's where it's always helpful to then refer on to a therapist as well as part of the team and be like, hey, anxiety is a part of performance, and so is, high achievement. Why don't you meet with them and just see if there's some skill? I like to use that word, some skills in place that can help them. And then that usually will get them there in a more general approach.
Yeah. And this was actually, she did share with me, she's a mom, but she also helps coach. I'm not sure in what capacity. And I think what she was really struggling with is, how do you start to have that conversation? I recommended, so if anyone's listening here, I recommended that they grab your book, because I think having these conversations where everybody's reading and having some similar discussion or having those resources. Any other tips for coaches or parents who are involved in the teams that wanted to open it up, but not point to one child and say, hey, I think this is you, but really create an environment where hopefully they can help that one or several, who do need help get where they need to.
Right. So if they want to, if they can go back and look on my Instagram feed, McCollum Place Victory Program had a 5-part series that was actually tips for coaches. That was excellent. I think CPSDA is going to make it into a handout. But I think if you step back and just say, I'm the coaching expert, but I'm not the nutrition expert, or, I'm not the mindfulness expert. I see you're kind of struggling right now. Why don't you just go check in and see what they have to say? Why don't you see if there's anything that you could do different? Because a lot of times they're already going to start experimenting with stuff nutritionally. And then that helps it be in a more neutral, like, hey, let's just see if she agrees that you're doing everything you can to maximize your performance. And then it takes it off the coach, but allows the coach to address, like, there's something there I see that's concerning me.
Yeah, that's awesome. We had a conversation as well, too, that a lot of young athletes just don't know about the risks of what we'll call dietary supplements, but they're pretty masqueraded as, even some of these protein drinks and some, the ready to drinks and some of these that could have ingredients in there that, especially with the popularity of CBD and some of that. So I thought one of the, really good places to have that conversation that we were chatting about was actually bringing in somebody or starting the conversation about, for you guys, this is something that's really serious, and it wouldn't be it's very unintentional. You wouldn't know that, this could be something that could trigger a violation. So that might also be, because I find that when somebody's doing a lot of supplementation, there's often that's a component of, hey, I feel like I'm searching for an answer, kind of digging into that part.
Oh, absolutely. And I'm going to be presenting next summer at Drug Free Sport on how the increased risk of body dysmorphia coincides with almost 70% of supplement use. So it has actually nothing to do with performance, like using this product to help with performance. It's usually to alter how the body looks.
Wow.
And I tell my athletes at every presentation, I was like, I'm going to get on my soapbox for 2 seconds, but just remember that even a multivitamin can be traced with something that's a banned substance. So always check it out with the experts. And at Drug Free Sport, they actually have a database that you can enter the supplement in. It'll tell you risk factors. It'll tell you if it has banned substances. So better to err on the side of caution. And as parents, don't let them go to a GNC unless you are there and you know that it's a proven effective supplement. And there's actually only two right now, and that's caffeine and creatine that are proven ergogenic aids.
Yeah. And then with creatine, obviously we have to have the conversation especially for women, how it bloats you, right? So like, if you're, I think that in the body dysmorphia, as you were talking about, that I had not heard that statistic. That's fascinating to think about, and just to think about how that's throwing things off. It reminds me of artificial sweeteners, or for those of us that were young enough to sadly enjoy the Snackwells era, it's just cheating, like we're trying to get away with, right? And I think about it, I was like, those Snackwells weren't even delicious, but were we
horrible.
We were so sold on them. It was like, but I think in that it is important to have that conversation of, if you're looking for a supplement to allow you to keep doing something and get better results, you're probably putting too much credit on that supplement. So, yeah, absolutely. Becca, thank you so much. I'm super excited. I had a laundry list of people I'm finding your sweet spot to. So I'm excited about that part. I threw up on here for anyone who has been watching, or for all of you who have been watching, that also we have our digestive evaluation. You guys, digestion foundational to all of this. So I think that piece is really important. And if you want to connect with Becca, we've got her website. We've tagged her in this. If you ask any questions, I'm going to go back and ask her, because I am not the expert. So we'll just make sure that we can keep everyone coming your way. And if you want to throw I know you mentioned it on your Instagram. If you want to come back up to Facebook and just throw in that link at some point in time, that would be great. I think people might be interested in checking that out. And sometimes on Instagram, it's harder for us to find it on that way. Okay. Yeah. Thank you so much for today. And thanks everyone for joining us. And remember, if you're watching on YouTube and you liked what you saw, give us a little thumbs up. And most importantly, please share this. The whole goal here, this is a nonprofit project. We are working on bringing experts to you so that you can find who is going to be the person that turns the light bulb on and helps you really, I'll just borrow from it today, find your sweet spot. So I love that part. Thank you. And thank you, Becca, again.
Have a great day, guys.